Karen Ann Quinlan, A Case of Ethical Research. A family background. Joseph and Julia were the parents of Karen Ann Quinlan. They were considered to be a middle-class family. Julia tried many times to bear children, and through support of their Catholic religion, adopted Karen Ann from Pennsylvania. After the adoption, Julia was able to conceive several years later and conceived and delivered two other children, giving Karen Ann a brother and a sister. Karen Ann was credited with being full of life and determined even at an early age. Her parents believed she was a true gift from God. She loved playing with her siblings, she loved sports, and she had a contagious life according to her family. Research also describes Karen Ann Quinlan as a beautiful woman who was not only athletic, but also had a talent for singing and playing the piano. The Karen Ann Quinlan case is the hallmark for the right to die. Karen Ann Quinlan was a 21-year-old female who once dreamed of being a singer and was looked up to by her younger siblings. She went into an unconscious state after a party near her home. On arrival to the hospital, there was tranquilizers found in her blood, and it was believed that she had ingested these tranquilizers mixed with alcohol intake. She was determined to be in a vegetative state and unable to breathe on her own. She spent several months on a ventilator and a feeding tube, and without any signs of improvement. 3.5 months later, her parents appealed to stop her ventilator and let her die. This is when everything changed. The next morning, the doctor called and said it was morally and ethically incorrect to allow her to die by removing her from the devices, and therefore she would not be taken off of support. This process went on for about a year when judges finally ruled it was okay for the parents to withdraw support. However, when they did, Quinlan was determined to not be dependent on the ventilator and was considered to be in a true vegetative state, meaning unconscious but alive. Her parents, of the Roman Catholic religion, were advocates for her death and persisted to have the physicians agree to discontinue her care and allow her to die. The hospital refused and prompted many legal battles. They began to continue to advocate for Miss Quinlan. She was assigned a guardian by the court system. Initially, the case was viewed as a challenge to the current state of the New Jersey's definition of death, and in fact, the week before the trial, an EEG showed minimal residual activity, which meant that she was not to be considered brain dead by criteria. 10 years later, after being placed in a nursing home, she finally died after battling pneumonia. She was finally allowed to die after courts ruled in favor of the parents and allowing her to do so. The trial would not challenge the death criteria, but instead center on Miss Quinlan's right to die. The dilemmas presented in this case. Doctors refused to honor the request because they believed that removing the life-sustaining devices was considered to be murder, which was the opposite of their duty to keep patients alive. This case, Karen Quinlan, was not dead by their textbook and criteria, so they were not ready to allow her to physically die. She became unresponsive to light and had no cognitive recognition or awareness of any life around or within her. To doctors, Karen was not dead, even though she was dependent on the ventilator at this time. This would be considered illegal to terminate Karen Quinlan's life because she was not defined by textbook as dead. This presented additional issues in determining whether or not one can demand to be allowed to die, also known and referred to as the right to die, which often leads to decisions on whether one can be allowed to die without being prolonged by machines, or the doctor's refusal to allow one to die peacefully without prolonging their death. Physician-assisted suicide and euthanasia was used as a comparison an attempt to support the physician in this case. In fact, the American Medical Association said that withdrawing her ventilator would be equivalent to euthanasia or murder. There was no medical reason by textbook criteria to allow the doctor to disconnect the ventilator and therefore prolonged her life rather than allowing her to die peacefully. Malpractice would also be a dilemma that is presented. Malpractice is defined as a departure from normal standards of medical practice within a community. In the Quinlan case, the physicians feared being charged with malpractice if they were to murder Karen Quinlan, which was their perspective of turning off the ventilator. Lastly, the one which was most difficult pertaining to this case involved moral considerations, ethics, and religious views, in addition to laws and medicine. It presented the question, what is the doctor's obligation to his patients? Considerations included looking at continuing to treat patients and put them through discomfort when they are at the end of life with no bouncing back, and allowing them to die. Doctors often question if this was murder. The father's request was denied because physicians were held to the do no harm Hippocratic oath. In the Anne Quinlan case, charges were threatened against the hospital and physician if they abided by the parents' wishes to withdraw life-prolonged devices from Karen Ann Quinlan. Ethical principles that were violated. The respect for autonomy. Karen was unable to exercise autonomy and was not respected until the end of the court case, many months after being in a vegetative state, a state her family said she would not have wanted to endure. Informed consent. Since she was in a vegetative state, she was unable to participate in informed consent and had not designated someone to act in her place. Physicians also used this as a support and not ending measures to keep her alive, as they feared it could mean murder. It is here where legal guardianship began to be explored in conjunction with advance directives, which became the hallmark of this case, in order to have someone who can make decisions based on patients who are terminally ill at the end of their life. The right to privacy. It was violated when the court ruled against the parents and made it okay for the physicians to overrule them. Negligence was also present in this case. Physicians were at the risk of being sued if they ended the measures keeping Karen Ann alive, and it was viewed in court as negligence on the doctor's behalf. It also presented in a return argument that it was negligent for the parents to end her life when she was not deemed to be dead, per the textbook definition. The results of this case had an impact on society and made several contributions to research. Battles persisted for about a year, and again was the hallmark for the nation's first right to die case. Judges mandated that there should be a prognosis committee. Advance directives, living wills, have evolved since her case, and all 50 states have enacted legislation to recognize the legal right of a competent adult to write out their end-of-life wishes, known as the advance directives. This is a means that serves as providing direction and guidance for healthcare decisions near one's end of life when he or she is no longer able to communicate those wishes. The right to die regulation was a result of this case. Creation of ethical committees in hospitals, nursing homes, and hospices also came out as a result of this case. There was also the creation of healthcare proxies and major changes in civil rights. Civil rights came in forms of laws and policies that are now prevalent in healthcare to ensure equal opportunities, especially in those who have designated end-of-life treatment. Bioethics in research has also become a big idea. Bioethics is the study of ethical, social, and legal issues that arise in biomedicine and biomedical research. It is important to everyone involved in the research to bring understanding and awareness about medical practice and things that uphold medical principles, ethical principles. Karen Ann Quinlan Center of Hope Hospice was formed by her father Joseph and mother, along with funds that were raised and donated on behalf of her families. It serves families in New Jersey and Pennsylvania. It was formed as a result of the learned experiences of the legal battles in which they underwent with Karen Ann, their daughter, to serve end-of-life patients and provide unlimited support. and these are the references.